My name is Millicent Bourdieu, and today I get the pleasure of interviewing Professor Pat DeWet, a past president of the Occupational Therapy Association. Professor DeWet, welcome.
Thank you.
We are in the midst of actually celebrating 80 years of the association, and for some of us it's halfway mark, as I turned 40 this year. But I want to talk to you about just a brief history about your association. First of all, the date of the association. When was it established?
So the OT Association was established in 1945, 3 years after the first occupational therapy diploma program was established at WITS.
But who started the association?
So the association was started by 8 qualified British OTs. The most notable was Miss Kuzas and Miss MacArthur and Miss Turner, who had been recruited to start the WITS OT program. Now, the inaugural meeting of SAAOT, as it was known in those days, was held on the 18th of August in 1945 in the Occupational Therapy Department in the attic of what was then called Medical House.
So 80 years down the line, if you can recall, who was the first president?
Well, I wasn't there at that time, but the first president was Mr. H. Pence of the Transvaal Provincial Council, and so he was appointed the first president. There were some executive OT members, but SAOT was supported by an advisory board of prominent doctors and nurses for many years. Having a medical doctor as president was a customary thing that continued to about 1966, when Vona de Toy, of Creative Ability History, was elected the first of 16 OT presidents who have led the association since then.
Professor DeWet, if we're looking back in terms of some of the significant milestones, why was it important to have established an association as this?
So literature reports that associations serve a powerful catalyst for personal and professional development in complex systems regulated and driven by political and socio-economic factors, something like our country. It also provides a platform for advocacy, education, and for advancement of shared purpose. So OTASA was recognized as the national organization representing the collective OTs, OTAs and OTTs, as well as OT students within the country. And the OTASA provides our membership with a mixture of personal and professional services. So particularly for professional growth opportunities, networking, membership, and webinars and congresses, also through council meetings and branch meetings. It also provides continuously medical education opportunities and competency development, particularly through CPDs and through the establishment of our OTASA professional body.
In terms of those resources, what resources do members actually get to have, and what tools are available for our members?
So, members have the SAJOT, the South African Journal of Occupational Therapy, which reports on South African research and best practice. It also facilitates research in our contexts, and they also have resources from the World Federation and also information from the World Federation, because all our members are automatically World Federation members. And we also is the understanding and the promotion of things like occupational science in the country. Recognition and credibility is also important, and this is important advocacy to support OT's unique role in service delivery and not to confuse our roles with that of other professionals. It's also important for social impact and sustainability initiatives in relation to service standards and things such as position papers, standards of practice, the SOPs, standard operating, I've forgotten the name now, and costing of services. And obviously the last thing is it provides ethical standards through the Code of Ethics and an ethical committee which provides assistance to members on any ethical issues that they come across.
So it's really important that the association gets deep down in making sure that we provide evidence-based practice within the South African context. But let's take some steps a little bit back. Some of the significant milestones that the association has made, if you can give us some of them.
Yeah, so I think one of the important things was the recognition in 1946 of SAOT as the official organisation representing OTs by the South African Medical and Dental Council at that time, and also that SAOT contributed to the establishment of the register, which was then called for medical auxiliaries in 1947, and compulsory registration that occurred in 1950. And very much later, the establishment of the OCP board in 1973.
In 1986 seems to be quite a significant year. What happened? Could you just elaborate a little bit about that?
I think one of the most early significant events happened in 1946 with the recognition of OTASA as the official organisation representing OTs with the South African Medical and Dental Council, as it was known at that time. And SAOT contributed to the establishment of a register at this time called Medical Auxiliaries in 1946, in which OTs were registered, and the compulsory registration occurred in 1950. And very much later, the establishment of the OCP board in 1973.
If we go back a little bit, in 1996, with regards to the OT regional group, can you tell us a little bit about that?
Well, I think firstly it's important to notice that SAOT was a founding member of the World Federation, and that occurred in 1951. And since then, we've hosted 3 World Federation Council meetings and the 2018 Congress that was held in Cape Town, which was the first to be held in Africa. So then, just to go to the regional group, so SAOT was a founding member of the OT Africa Regional Group in 1996. And I think another important event that happened in 1993 was the establishment of the OT office, the first OT office. Before that, we had been an office in a filing cabinet that got moved around. So first we were in rented space, and later we purchased the office space in Hatfield Park. I think an important development has been the growth of the staff to 5 full-time members now, including a COO, which has greatly helped the administration of the association.
It's really important to have members and office staff that runs the machine well. But something quite significant happened in 1986 with the World Federation of Occupational Therapy. Could you tell us more?
Yes, so at the World Federation meeting that was held in Exeter in the UK, a proposal that was put forward on the expulsion of SAOT for the oppressive laws in the country due to apartheid. At that time, SAOT invited a World Federation fact-finding mission to South Africa to come and investigate the service, particularly service delivery. And although we were never expelled from the World Federation, it was a really big wake-up call. And in 1986, a transformation subcommittee was formed under the planning committee at that time. And in 1996, there was a whole move towards transformation, and there was a transformation workshop and a decision to completely transform the association, and the association was also renamed from SAOT to OTASA. Associated with that was also a 1997 submission to the Truth and Reconciliation Committee. And as a result of many of these transformation issues, OTASA undertook a national dialogue across the country, which resulted in a collective strategic plan to foster unity and cohesion within a growing professional divide. And this has been the guiding document, in fact still is the guiding document for the work of OTASA currently.
Professor DeVette, if we move on to the next part and we're talking about in terms of over the years how the profession itself has ensured growth, firstly for the profession, and then we can talk about the support for the members.
So I think one of the important things that happened early in the profession's development is the establishment of the South African Journal, which occurred in 1945, and then later the newsletter in 1949. I think an important development was the establishment of the regional groups. First two were established, the one in the Cape and the one in the Transvaal, which happened in 1946, and much later in other provinces as the numbers grew. The last group to be developed was in Limpopo, and that occurred in 1986. So many of the professional the significant milestones have been associated with advocacy for the profession. Initially, it was related to the establishments of posts in hospitals across the country, and later higher level posts within the provincial departments of health, then the National Department of Health, and also within the National Department of Education. I think another important thing was the establishment of training. So we started with two early, VIT was the first program, the second program was at the University of Pretoria, and we now have eight training programs. We were initially involved in the minimum standards of training in 1944, and then again in 1966, which occurred before the establishment of the OCP board. And advocating for the expansion of educational programs in different provinces has been an ongoing issue. And as we need more OT, so we need to expand into other provinces where there is no training. I think the other thing that we've really worked hard on is training for our mid-level workers, initially as OTTs, and then as a career development for them in the OTT course.
So when you look at support in terms of the professionals, what type of support is there?
So I think one of the things that created support was working with the disability sectors. So initially we formed very strong relationships with the disability sector on national and regional levels. And before democracy, there were lots of national councils, and they were very helpful in terms of developing OT services throughout the country. So the first one of note was the National Council for the Care of Cripples, the National Council for Mental Health for the Blind, the Epileptic League, the Paralympic Games Association, and somewhat later the South African Association for Learning and Educational Disabilities, which all occurred before 1979. Now, many of these organizations got restructured at democracy, so they don't actually exist anymore. But OTASA has remained strong in the disability sector, and we're currently affiliated to SADA, the South African Disability Alliance. Also, particular issues that affect our professions have been handled through the development of standing committees, and they support very many different aspects of our members' needs. For example, we have an education standing committee which looks at our training and fit-for-purpose professionals. Our research committee, which promotes research in the country, and particularly that we need to support our role in South Africa. We have an occupational science committee, which is an important professional development. Ethics committee, the coding and procedure committee that deals with the private practitioners coding issues. The publication committee, which organizes our three issues of our journal, and the focus committee. We have a private practice committee that deals with private practice issues, a marketing committee that advocates and publicizes the work of OTASA, and finally a CPD committee, which is incredibly busy in providing all the resources so that we can remain up to date with our 30 CEUs. I think that another important thing is that the branches essentially look after the needs of OTs locally, and I think one additional and important establishment has been that of OTASA students, or what we call OTASA-S, and the purpose of which is to form a pipeline of a leadership and governance structure for students leading into a leadership pipeline for the profession.
This is absolutely great. Professor Debate, what would be your last message in terms of celebrating the 80 years of the association?
Well, I think personally my association with OTASA has been very long-standing, and it has taught me many things about the profession and the need for advocacy that I would never have learned in my workplace. So I really support all the work that they have done over the years.
Well, thank you so much, Professor Devet, and once again, ladies and gentlemen, thank you so much. And Professor Devet, we wish you all the best in your new adventures as the celebration comes to end. Thank you.